Hi guys, welcome to Trial Talks with Princy. In today's video, we are going to discuss about the common terminologies in clinical research. If you are new to this channel is all about the clinical research industry. So let's get into the topic. So let's see, the first one is the audit. Audit are performed and ascertain the validity and reliability of information, also to provide an assessment of a system internal control. The goal of an audit is to express an opinion of the person, organization, or system. So audit is nothing but it is like a quality check. So what they'll check, they'll see the information is correct or not, or whether it is reliable or not, and whether the system is working properly or not. So they will see all these three things, and the main goal of this an audit is to give an opinion about whether everything is okay or not. So let's see the audit certificate. So audit certificate, a term used in the context of clinical trials for a document which certifies that an audit has taken place. So this is like just a document. What it says a audit has been done. And the third one is the audit report. So document prepared by the auditors appointed to examine and certify the accounting records and financial position of a firm. So it is a detailed document made by the auditors, whether they write down their findings and confirm if the records and accounts are in a correct. So this is all about audit report. So let's understand in short to memorize these three terms. So audit is, it is a quality check. So in order to remember, I'm just saying in a short. So audit is, it is a quality check. And audit certificate, it is a proof of an audit. And the third one, it is audit report. So audit report is nothing but it is a detailed findings of the audit. Now let's see what is Audit Trail. It is a paper or electronic trail that gives a step-by-step documented history of a transaction. It enables an examiner to trace the financial data from general ledger to the source documents like invoice, receipt, vouchers, etc. So Audit Trail is nothing but it is a step-by-step record of what happened, and it's like a history in our mobiles or systems like laptops. What happens, whatever the data we search, whatever we see, when we have seen everything, the data will be stored like a, and whenever we check the history, it will shows that when we have seen, what time we have seen, everything will be recorded, right? At the same way here in clinical trials also, the data will be recorded and it shows like what changes has to be done, who has done the changes, and why they have done. Everything will be recorded. So that process is called audit trail. Okay. So next we'll see the inspection. So conducting the review of any documents, facilities, records, and any other resources at a trial site by the sponsor. So who will do the inspection? The inspection will be done by the sponsors, regulatory authorities. So what they do, they will do the inspection. I mean, they'll check everything like documents, facilities, and the records. Why they will check? Whether they're following the principles, set of principles like GCP guidelines are there and SOPs are there, protocol, whether they are following all these things. So they will do the inspection. So and they will making sure that the study should go in a uh, right right way. Okay. So next we'll see the IDMC. IDMC is nothing but it is an independent data monitoring committee, a committee which assesses the progress, safety, and efficacy of a clinical trial and approach the sponsor on whether to continue, stop, or modify the trial. So IDMC is nothing but it is a independent data monitoring committee. Usually who will be there in this, like doctors, statisticians, and scientists, okay, who are not a part of the trial team. So their job is to keep an eye on the clinical trial while it is happening. So what they do, they will check the trial is safe for the patients or not, and they will check, they will review whether the drug or a treatment is working effectively or not. Okay, and also they give the advice to the sponsor or on whether the trial should continue, stop, or to be changed. So this is all about the IDMC. Thank you so much for watching today's session. I hope this video helped you to understand these clinical research terms. And if you found it is useful, then like, share, and subscribe to Trial Talks with Princy for more easy learning videos. See you in the next session. Till then, take care and keep learning. Bye, guys.